Hi, I'm Wes Nichols from March Capital. I'm here with the founder and CEO of Suki, Puneet Soni. I'm very excited to have him here at Montgomery Summit for the first time and talk about what he's been building in the healthcare and the AI space. Puneet?
I'm glad to represent Suki. You have obviously been a supporter for a long time. For those who don't know, Suki is, think of it like a Siri for doctors. It's basically a voice-based digital assistant for doctors. And you probably saw this when we were starting. I think the biggest public health crisis in the country that few people talk about is this burnout in clinicians that's happening. And the pandemic hasn't helped, right?
And so much worse.
Yeah, from our perspective, we are basically trying to make healthcare tech assistive and invisible so that clinicians can focus on what they do best, which is taking care of patients. But tell me about how you found Suki, because it's in that context that you even discovered this company.
Yeah, firsthand. I was sitting watching Sunday morning, 10 a.m. or so, watching Fareed Zakaria like I usually do on Sunday, and all of a sudden I saw a kaleidoscope in my eye. And this is probably not a good thing because I couldn't see out of my eye. And I called my doctor and he's like, well, it's either an ocular migraine or you're stroking out. So he sent me to the hospital, went to Cedars-Sinai, went right in, wound up meeting the head of ophthalmology. He said, yes, indeed, it was an ocular migraine. For those people who do have kaleidoscope in their eye, it should go away after 20 minutes. So if it doesn't, you're having a stroke. But I've never had that before. Comes to find out I have a lot in my family. Dr. Bose grabbed his phone and he starts speaking really fast into it. All these details about me and what he's seen and what he wants me to do, and I, at the end I'm like, excuse me, is like, who's the poor sucker who's going to have to sit down and listen to that? Because I was just imagining someone having to go back and rewind it and listen to like a sentence and type it in and because he was going really fast and he has a very heavy accent, and he said, oh, I'm a test doctor for Suki, and I love this. It's already now it's already inserted into your Epic record, your health record. It's billing codes have already been assigned. If I had to give you prescriptions, it would already have been sent to your pharmacy, and I don't have to touch it. And now I'm on to the next patient. And he said, I used to spend twice as much time with paperwork as I used to spend with patients. That's crazy. And he loved it. So that's when I reached out via Gokul Raja, our mutual good friend, and found I had to meet you. So
the best interview is when the person interviewing knows more about the company than the person building it. So I'm glad.
When I had a medical emergency, you need more people with medical emergencies.
I'm glad that you're talking about it. I think it's a very important problem, Wes. And even in this whole crazy macroeconomic scenario with the pandemic, we have just been hit one after the other with some catastrophe or the other. It's getting even worse in healthcare systems and for doctors. And what I have noticed, at least from a business perspective, is that the need's getting much more significant. But interestingly enough, there was a time where there was a lot of conversation about how to use Suki so that you can increase revenue and the ROI from that perspective. And now it's become, oh my God, we have very limited budgets, and we need to make sure these doctors are still taken care of. And Suki, because it's a software-only product, can be scaled and adopted dramatically, significantly by doctors. So we're seeing a lot of interest now from the cost perspective. Well, earlier it was from the revenue perspective. So it's a very exciting time. Not easy from any measure because you're dealing with a very complex multifactorial, multivariable setup. But we are progressing and moving forward. Now we're in 24 plus specialties. We are in 100 plus clinics and health systems across the country. Some of the largest companies in the market are actually using us as their voice backend. And so even if I say so myself, I believe that the biggest, most interesting technology company ever built in the next generation is going to be in healthcare. I think we have a non-zero chance that we will be that, but we have a non-zero chance that we'll be that. So that's what's exciting me, and I'm glad that I'm here so that I can talk about this with investors and drum up interest in basically what I think is going to be the next generation of healthcare tech.
Well, it's also very purpose-driven. I can tell from you and your team that this is something that you're passionate about, and you think about the value you're creating. It was national news for the past 2 years about how our doctors and nurses are burning out from all the crap they're dealing with COVID rates and the emergency rooms, and I've seen firsthand the amount of paperwork that they have to do. With the old systems, the incumbent systems that are out there, I've sat and watched over nurses' shoulders to see what they have to do, and they speak into like this attached microphone to an old PC, and then they have to open up another window, and they have to get billing codes and cut and paste them and put them in.
For every day, 2 to 3 hours of administrative work on top of all clinical work. Imagine like if you do 16 meetings a day and I asked you to write down every single meeting, and if you didn't write them down, then you have liability issues and you will not get paid. That's what we have done to our doctors. They've become like data entry clerks. When you talk about mission driven, this is one of the reasons why March has been very important to us also. I think we have also inherently as a company attracted the investors who actually care a lot more about the why of what you're doing this and not just the outcome from a financial perspective. And so when I met you, you saw the problem firsthand. You found a way to get to me and talk about it. It was pretty clear that you're here for the long haul. And I think this is very important for anybody who's listening out here, that when you actually go ahead and build companies, you have to hire your investors. You have to find those investors who are actually going to be with you for the long haul. And you obviously, I'm very glad that you're here, especially with this crazy.
And I've had a few good ones and a bad one, so I can speak to that as well.
You've seen that before, right?
Yeah. No, it's a really good point. You have to find people that understand and support the vision and want to see it through. And the growth you're seeing this year, I don't know if you're able to talk about that, but the growth is just, it's going to be a phenomenal year.
It's insane. We are 6 months in, our revenues tripled, our user base has more than tripled, and the number of deployments we have to do. It's actually interesting because you have to kind of deal with that while also making sure that you burn fiscally thoughtfully.
Yes.
Because the next
growth.
18 to 24 months are going to be interesting. The days when you could just throw money at something just from a growth perspective is probably gone. Are you seeing that with all of your other companies?
100%. Yeah, that's one of the themes of this week is all about efficient growth. Like, what does that balance look like, and how do you keep your foot on the gas and the brake a little bit at the same time? Or we, for the past 5 years, have been forgetting that we had brakes, and I think as a result that party's ended. So,
but it helps when you have an investor who's also an entrepreneur. Thank you for having me here. It's a pleasure. I think I'm going to be spending the entire day talking to people and telling them, carrying the message of Suki. But I'm looking at you to make sure that you do that too. And for everybody who's listening here, Suki is a voice-based digital assistant for doctors. It's our ambition to make healthcare tech assistive and invisible. And what we're doing here is just the beginning of a very long journey.
So, no, absolutely.
Thanks.
Great. Well, thank you very, very much for being here.
Awesome.